Dear Bhagwat from final year. My roll number is BP1650236. Here I am presenting the information regarding levodopa. Levodopa is a prodrug of a dopamine that is administered to patients with Parkinson's due to its ability to cross the blood-brain barrier. Levodopa can be metabolized to dopamine on either side of the blood-brain barrier, and so it is generally administered with a dopa decarboxylase inhibitor like carbidopa to prevent the metabolism until after it has crossed the blood-brain barrier. Once past the blood-brain barrier, levodopa is metabolized to dopamine and supplements the low endogenous levels of dopamine to treat the symptoms of the Parkinson's. The first developed drug product that was approved by the FDA was a levodopa and carbidopa combined product called Cyanmed that was approved on May 2, 1975. Indications include levodopa is most commonly formulated as an oral tablet with a peripheral dopa decarboxylase inhibitor indicated for the treatment of a Parkinson's disease, post-encephalitic Parkinsonism, and symptomatic Parkinsonism following carbon monoxide intoxication and a manganese intoxication. Dose adjustment. Initial dose which we can administer is 25 to 500 mg orally twice in a day. Maintenance dose includes 3000 to 6000 milligram per day in 3 or more divided doses. For restless leg syndrome, 50 mg orally 1 to 2 hours before bedtime with decarboxylase inhibitor. Most patients experience a good response on a daily levodopa dosage of a 300 to 600 milligram per day, usually divided 3 or 4 times daily for 3 to 5 years or longer. Doses higher than a dose necessary to control the symptoms adequately should be avoided because higher doses increases the risk for the development of dyskinesia. Available brands are Oxonol, DIURETIC 4 25 mg, Dopa 200 milligram injection, and other brands names are Reteri, Dopa, Parcopa, and Cypen, Stelvo containing the Garbidopa, and Levodopa is no longer on the market. Generic alternative may be available. Dosage forms include immediate release, solid system, sustained release dosage form, dual release system, liquid and dispersible formation, gastroretentive dosage form, suspension, inhalation powder, and injection 2 mg per ml. Now, alternatives medications of a levodopa. The oral dopamine agonists pramipexole and ropinirole are primary alternatives to levodopa as initial treatment. They are efficacious because but substantially less than the levodopa. Levodopa does not prescribe in pregnancy as it may lower the prolactin and interfere with the lactation. Levodopa is present in a human breast milk, and so the potential effects of the nursing while taking the levodopa should be considered before prescribing levodopa to nursing mothers. Drug interactions. Its interactions include the monoamine oxidase inhibitors, antacid, antihypersensitive drugs, antiseizures, papaverine, vitamin B6, CCB, B blockers, and diuretics. Symptomatic postural hypertension occurred when levodopa was added to the treatment of a patient receiving hypertensive drugs, and non-selective monoamine oxidase inhibitors slow the breakdown of the levodopa and dopamine in the brain and may boost the effect of a levodopa. Pyridoxine increases the peripheral metabolism of a levodopa. Side effects include Dizziness, loss of appetite, diarrhea, dry mouth and throttling, constipation, change in sense of a taste, forgetfulness and confusion, nervousness, nightmares, difficulty falling asleep and staying asleep, headache, weakness. Its irrational use is used to treat the dopamine responsive dystonia, DRD, and the restless leg syndrome. Also useful in amblyopia when used with the other treatments. Levodopa is an antidepressant as it has been shown to reduce the depression. It is also used to treat the anxiety occur during the medication. Now we have a case study. John Miller is a 58-year-old right-handed woman who presents to neurology clinic because of a stiffness on her right side over the last 6 months. It takes her longer to do work because it takes more effort to get the movement started and her muscles feel stiff. For the last year, she feels that she does not think so quickly and it takes her longer to remember the things. She also complains of a constipation and decreased libido over a year. Recently, it has become difficulty to read because the words occasionally look blurry. These symptoms have affected her job performance as a high school gym teacher, resulting in her contemplating early retirement. We consider for the cure of this condition. Here we have a soap notes. First, in the subjective, the chief complaint that she is complaining about she have a trouble getting herself started and takes longer time to do the things. And she has a no current medication to be used and no allergies are observed in her condition. To the sodium level 136 milliequivalent per liter, potassium level is 4.3 milliequivalent per liter, while chlorine is 101 milliequivalent per liter, and hemoglobin B is 13.5 gram per deciliter. Her symptoms shows muscle stiffness, decreased libido, and constipation. Through the present illness, the patient's symptoms are consistent with early mild Parkinson's disease can be observed in a plan. There is no lab or imaging test that is recommended for Parkinson's disease. However, in 2011, the US Food and Drug Administration approved an imaging scan called the DET scan. The technique allows doctors to see the detailed pictures of the brain's dopamine system.